Physiological jaundice. Neonatal jaundice and breast milk jaundice are discussed under physiological jaundice. Firstly, neonatal jaundice. This is also called as neonatal hyperbilirubinemia. In all the newborn infants after the second day of life, mild jaundice is seen. Now, this mild jaundice is because of increased destruction of RBC and also because of the immature hepatic system not able to conjugate the entire bilirubin. Now, in such cases, bilirubin does not increase more than 5 mg per deciliter and it also disappears by the second week of life. So, why there is jaundice is because of increased rate of destruction of RBC and also because of the immature hepatic system which is not able to conjugate the entire bilirubin. Now, if the bilirubin content, that is the unconjugated bilirubin content, is more than the amount of albumin, because albumin acts as a transporter for the bilirubin and it delivers to the hepatocytes. If the unconjugated bilirubin content is more than that of the albumin and if it reaches between 20 to 25 mg per deciliter, this bilirubin can penetrate the blood-brain barrier. Now, when it penetrates the blood-brain barrier, it results in hyperbilirubinemic toxic encephalopathy or otherwise called as kernicterus, which can result in mental retardation. So, to avoid this toxic conditions or kernicterus, the neonates are kept under blue light or they are given phototherapy. Now, this phototherapy, what does it do? It promotes the excretion of this unconjugated bilirubin by converting it into some of the derivatives which are easily excreted in the bile. And also, some of the infants are given this phenobarbital, which is a type of drug which promotes the bilirubin metabolism and helps in easily excretion, thereby decreasing the jaundice. That is neonatal jaundice. And the next is breast milk jaundice. So, in some breastfed infants, there is prolongation of jaundice. Why there is prolongation of jaundice in this breastfed infants is because of the estrogen derivative. There is some type of estrogen derivative in the maternal blood that is excreted through the milk. Now, this estrogen derivative mainly inhibits the glucuronide transferase enzyme, which is responsible for the conjugation of bilirubin. So, this estrogen derivative from the maternal blood, when it is excreted through the milk, when it reaches the infants, it inhibits this glucuronide transferase enzyme, resulting in defective conjugation, which causes prolongation of the jaundice. And this subsides by itself. So, these are the two different types of physiological jaundice. One is neonatal jaundice, where there is increased destruction of RBC and immature hepatic system, causing in rise of unconjugated bilirubin levels. And the other is breast milk jaundice, where there is prolongation of the jaundice seen because of the estrogen derivative that inhibits the enzyme glucuronide transferase.